Mycobacterium intracellulare is a species of the phylum Actinobacteria, gram-positive bacteria with high guanine and cytosine content. One of the dominant phyla of all bacteria, belonging to the genus Mycobacterium. Description: gram-positive, non-motile and acid-fast short to long rods. Colony characteristics: usually smooth, rarely rough and non-pigmented colonies. Aging colonies may become yellow. Physiology: growth on Lowenstein Jensen medium and Middlebrook 7H10 at 37 degrees Celsius after 7 or more days. Resistant to isoniazid, ethambutol, rifampin and streptomycin. Differential characteristics: M. intracellulare and Mycobacterium avium form the M. avium complex. Mac. Remarkable its heterogeneity within different M. intracellulare isolates. Pathogenesis: most frequently encountered in pulmonary secretions from patients suffering from tuberculosis-like disease and from surgical specimens from such patients. When isolated from human secretions, it is often the etiologic agent of pulmonary disease, although frequently isolated as a parent casual resident. Biosafety Level 2. Type strain: first isolated from fatal systemic disease in a child. Found in soil and water. Strain ATCC 13950 equals CCUG 28005 equals CIP 104243 equals DSM 43223 equals JCM 6384 equals NCTC 13025. Type strain of Mycobacterium intracellulare at BacDive, the bacterial diversity metadatabase.